Yes.
And you have seen so many beddings that we apply. So if there is any extra thing you need it,
Yes, sir.
you leave the patient covered with only top sheet. It's only this one sheet that you are going to leave the patient covered with. But the bottom linings are there. You don't remove them.
Okay.
Is it clear?
Yes, sir.
The bottom one, you don't remove them. You leave them in position.
Okay.
But anything that is on top, you remove it.
Blanket.
Leave the patient covered with only
Blanket.
one.
Okay.
Is it clear?
Yes, sir.
So now you explain the procedure to the patient. Let my assistant explain the procedure.
I will call him.
You know, he is in charge of this ward. So he's the one who knows the patient.
So, okay, so madam, we are going to take you back so that makes you comfortable, so that you know the idea, and people will look you so neat and tidy. Are you agree with procedure, madam? Yes. Thank you.
That is how we explain procedure to
Ko na
patient.
za mu ji wanka ko a su ke tsafta da sauransu. So idan na patient understand my language.
Yes, sir.
So primarily you tell the patient what you are going to do and your purpose of doing it. Then you seek for patient's
Consent.
Is it clear?
Yes, sir.
If she has doing yes, so you go and carry on with your preparation. If not, you try to convince her. If she still refuses, so you have no choice to convince her. But now she has agreed, and we prepare our everything. Now we are at the patient bed side. Is it clear?
Yes, sir.
So you start by mixing your water. It's too hot. Let us add more hot water.
Tua makan. Okay.
Okay, now.
Size reading.
Celsius. So now you take your towel. As I said, we assume that we remove all what? Linings and the patient cloth. The patient cloth should be what? Removed. The patient is only covered with the top sheet. So now you take your towel. This my assistant. Assist me to secure the towel over the pillow. So now you take your planning and you wrap it around your palm.
Okay.
That is the planning. You put inside the water. And then you take your soap. Hand gloves. So now after you rinse the soap. And you use this one to remove the soap.
That's all in the purple shot. Depending on the hospital now. There's one you go there, one you go high.
Yes, right.
Yeah, only card, 50,000, 100,000. Hospital card. Okay.
Rinse your flannel again. You make sure that you rinse it thoroughly. So after rinsing, make sure that there is no soft.
Okay.
So you use it to clean the eyes. You start from the medial to lateral. You cleanse. So now you are done with the
Face,
and
neck. Okay.
remove the towel. You arrange the pillow. Use the arm. Arm. Place the towel under the arm that is away from you. Then you take your soap again. You wash. You wash thoroughly in between the fingers. Inside the axilla, everything is correct. Wash. After washing, then you rinse. Remove the soft. Now you ask the assistant to dry. So now at this point you keep the what? The flannel. Do you know pressure areas?
Yes, sir.
Do you know pressure areas?
Yes, sir.
Pressure soap.
Yes.
So now you attend to all pressure areas that are on the arm. Therefore, now you remove the flannel and you use your hand. Take the soap. You know elbow. It's one of the pressure areas. You attend in circular movement. If the patient is continent, then you apply
Continent.
powder. Continent.
So what's the question?
If the patient can control urine and feces.
Okay,
the
continent.
patient is continent.
Okay.
The patient who cannot control
Incontinent.
urine and feces, the patient is
Incontinent.
So if the patient is continent, that is he can control urine and feces. He is not in moisture. Now you apply powder on the pressure areas. Apply powder. If the patient is incontinent, you apply Vaseline.
Okay.
Instead of powder, you open your Vaseline and you apply on the pressure areas.
Because the patient is incontinent.
Yes, if the patient is incontinent. Why?
Because the water will wet in the powder.
The water will get the powder and it will go inside the skin.
Skin.
And that moisture now can lead to dead soap. But if you apply Vaseline, Vaseline is barrier cream. The reason why we call it barrier is that it is creating barrier between
The skin.
moisture and the skin.
Skin.
Therefore, even if there is moisture, the Vaseline now will be a barrier. It will not go into the skin and cause dead soap.
Get some.
So that is why we apply powder if the patient is continent. If the patient is incontinent, then you apply Vaseline. So when you are done with that arm, you cover it. Okay? So you open the one that is towards you. You remove the cover.
Pascal.
And now we spread the towel to the arm that is towards you. Is it clear?
Yes, sir.
You take back your flannel and you attend in the same way. That is, you clean, you dry, you rinse. Your attendant now or your assistant now will dry.
Dry.
And then you keep the flannel, take soap and attend to pressure areas. If continent, apply powder. If incontinent, apply Vaseline. So we are done with this. Now we open the trunk. There. You take your flannel back again. You take your soap. And now you wash thoroughly the front.
That's a moment inside wash.
That is the chest and
Abdomen.
You wash thoroughly.
I'm listening and I enjoy it.
Is it clear? Take care of the umbilicus. But in case of female patient, especially with pendulous breast, under the breast is another area that you have to give special attention. After drying, now you rinse. After rinsing, now you ask your assistant to dry. So after drying, now you discard this flannel. Is it clear?
Yes, sir.
First flannel now you discard. Whenever the water is cold or is dirty, you discard inside this receiver. And you mix another one. Whenever it is either cold or is dirty or is soapy, you discard inside this receiver, produce water, and you take your hot and cold water and you mix another.
40 degrees.
Under this, is there any pressure area? No, here. No pressure area. Are we sure? Umbilicus. No, umbilicus is not a pressure area. You just give it special attention while cleaning because that is accumulating inside. Under the breast is a pressure area. In case of female patient with pendulous breast, under is a pressure area that can develop very soon. So you have to give it the special attention as you need. That is, you take your soap, you apply the circular. Sorry. This is the set that we are using. This you dry and dry. Assistant ko yayi nisa. If continent, you take your powder and you apply under the breast. Yes. If incontinent, then you take your Vaseline
And apply.
So this we are done with the face, we are done with the upper limbs, and we are done with the chest and
Trunk.
abdomen. Is it clear?
Yes, sir.
At this point, you discard the first flannel.
Okay.
First flannel, you discard it. Then you take the second flannel. Then you cover the patient. You see that we never expose the patient's body. Privacy is very important. Remove the towel. So now you spread the towel under the limb that is away from you. And you take your second flannel, you put round your then you apply the salt. And you wash the whole length of the lower limb. Wash everything, make sure that you wash every nook and cranny, every corner should be washed, should be thoroughly washed.
Good after a weekend, you need to get back to it. You don't do it again.
After washing, then you rinse.
Okay. My friend, you really divorce couple. I would also sit down, listen to one back.
This is right.
It's more easier than looking for YouTube again.
After drying as usual, you keep the flannel and you take soap so that you can attend to the pressure areas. We have sides of the knee joint, we have the ankle joint, we have the heel, and we have here the hip, side of the hip. All these are pressure areas. You have to attend to them. You have to attend to them. Then you apply either what? Either powder or Vaseline, depending on continency or incontinency of the patient. Here you take the ball and put it on the bed. Put the leg inside and stream the fingers. What is streaming? Are we safe? You stand up. Streaming the fingers. When you put it inside, you stream in between the fingers. That is what we call streaming the fingers. You put inside the water and you wash and you stream. Is it clear?
So.
Even for the upper limb, we do the same. After washing, you can put it inside and you stream the fingers. Is it clear? What all? No, if you are streaming, you keep the flannel. You keep the flannel and you use your fingers to stream patients.
So what is the purpose?
So when you did this, now you cover the microphone. So remove the tools.
Let's walk on the floor, patient.
So now we are going to do the same. Let's take your flannel, wash, dry, attend to pressure areas, then you put it inside and you stream the fingers. Okay, remove the towel. So now we stop the back and the patient will be on side.
The perineum. The perineum.
You ask the assistant to stop the patient.
One to the or maybe later to be the last. I can do all.